This is Optimum Health for All. I'm your host, Oge Odia.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all.
Today, we're going to talk about the aging heart. That is cardiac diseases in the elderly. As you grow old, the cardiac disorders that can occur.
Yeah.
And we'll talk about these cardiac disorders and what one can do about it. Today, we have with us Dr. Bunmi Ajala. He has featured in this Optimal Health for All before. We talked about hypertension, remember?
Yes, we did.
So today we're going to talk about the aging heart, cardiac disorders in the elderly. Dr. Bunmi Ajala, you are welcome.
Thank you very
Bunmi
much.
Ajala is a consultant physician cardiologist. So what are the special things that we want to know about the aged, the elderly, as we grow old? How does the heart adjust to old age?
Thank you very much. I am very glad to be here and talking about cardiovascular diseases in the elderly. So, what exactly happens with the heart as you grow old? As you grow older, there's some changes. We call them physiological changes. What that means is that there are some normal changes that can occur in the heart just by virtue of the fact that you are growing older. And when this happens, they can cause some problems for the elderly person. So what are these changes? So as you grow old, your blood vessels, these are the tiny tubes that carries blood through your body, they begin to get stiffer. So as they're getting stiffer, the blood vessels are not relaxing properly. And when they don't relax properly, what can happen? An elderly person can develop hypertension just by virtue of growing older. So, which is one of the problems of um, the aged. That's one of the heart diseases that can occur in the aged. So, aside from that, the older person is also prone to developing what we call arrhythmias. Arrhythmias are abnormal heart rhythms. So, these abnormal heart rhythms can develop just by virtue of the fact that you're growing older. In fact, studies have shown that the older you get, from 65 and above, then the tendency that you develop abnormal heart rhythm is higher. And these abnormal heart rhythms, what can they cause? It can cause a person to have stroke. It can cause a person to have heart failure. It can cause a person to just be feeling uncomfortable and having what we call palpitation. I can feel my heartbeat. And this is an occurrence that can occur with aged people. Then we also have the blood vessels. As you grow older, a process that happens right from the time that you were born, atherosclerosis, that's hardening of the blood vessels. It increases, in fact, it becomes accelerated. That process becomes accelerated as you grow older. And this process of hardening of the blood vessels, which we call atherosclerosis, are the things that can now lead to heart attacks. It can also lead to worsening hypertension because obviously the blood vessels are not releasing the things that helps them to relax better. So those are a few of the things that can occur by virtue of the fact that the heart and the blood vessels are just
So there's a
aging.
possibility of hypertension,
Yes.
either developing or getting worse.
Or getting worse, yes.
Then there's possibility of heart attack,
Yes.
especially when you have other risk factors for heart attack,
Yeah.
like high cholesterol
The high
level.
cholesterol, hypertension,
Yeah.
diabetes, or excessive weight.
Okay, so those are some of them. There are others. For example, the valves, the cardiac valves, they may
Oh,
have some
yes.
problem.
Oh, yes. So as you get older, just the way people get arthritis, not because they're doing anything wrong, but because you're getting older, your joints are not as, nourished as they should be. Same way with the heart also. So the valves that open from one chamber to the other in the heart can also start getting older, and we call it calcific. Like you start to have calcium deposits, they become harder. And so because of that, they're not opening well, or they're not even closing well. And when that happens, it can start to cause build up of pressure within the heart wall muscles. And that alone can lead to what we call heart failure. I'm sure most of us have heard heart failure
But
before.
heart failure means
So
that
heart failure is a condition, not that the heart is not working at all. The heart is definitely still working, but it means that the heart is working under a lot of pressure. So you find people that have heart failure, they struggle to do the normal activity of daily living. To walk from this block to that block becomes a problem for them. Their legs start to get bigger. They're even unable to sleep lying flat. They're choking and cannot breathe well. So that condition is actually common in the elderly patient, and these are some of the things that can cause it. Aside from hypertension and also heart attack, you can have the aging valve leading to heart failure in the
so
older.
these occur and it's usually progressive.
Yes.
So what can we do to slow down the progress?
Okay. So slowing down the process of all these conditions happening in the elderly, it starts from when you are much younger. So the lifestyle that you decide to live as a younger person can determine how this process of aging, how it rapidly evolves. Everybody is going to get old, and all these processes will likely occur. But if you decide to choose healthier lifestyles at a younger age, then you can have all these things reducing in the way that they progress. So trying to exercise, trying to maintain a good weight, trying to eat right. Eating right is a very key component of what can reduce the acceleration of the aging process. So eating right, fruits, vegetables, and cutting down on a lot of carbohydrates, fats, and unhealthy food.
So control of weight is also
So control
important.
of weight, also maintaining a very healthy weight, and trying to exercise. Exercise is not only for weight maintenance. Exercise also helps to build the heart. It helps for cardiovascular fitness. So it makes your heart stronger and healthier. So that's part of what
But there's,
exercise is.
as you grow older, the type of exercise you do will have
Yeah,
to
yes, might
vary.
have to change
Like
when you
from
grow older.
what says,
So
if you go slower,
you go slower, and
mm-mm-mm,
that's where building resilience come in. If
mm,
it's something you have been doing, you'll likely be able to do at least a bit more when you are older. But if you have not been doing it at all, then
you just
more
start,
you'll start gradually and
mm,
then build as your body
and I
can take.
can take it.
Yeah.
Okay, thank you very much. So, which means that we have to control blood pressure as well.
Oh, blood
Uh,
pressure, even
um,
in there's a myth that people think that, oh, I'm old, I can have blood pressure of 160, 90. Studies have shown that reducing blood pressure, even in the very old, I mean 80 and above, reduces the risk of having heart attack and all other heart related events. So the key thing is that even in the very elderly person, it's important to control your blood
blood pressure
pressure
and
to normal,
diabetes.
and sugar levels, because
Yes.
that increases your risk of inflammation and a lot of things.
Okay, so medications, depending on what medication we want to take, like maybe they are old, people say take vitamins, take some other medications. Is there any special medications for the elderly?
No, there are no real, except if you are trying to maybe treat a condition like for postmenopausal women, they might benefit from taking calcium. Omega-3 fish oil, which is just a multivitamin, is just generally good for the heart, and anybody can have that. So, but there are no prescribed. You treat patients or people according to their
How
ail
they present?
how they present
Mm,
and their ailments.
ailments.
But the
Okay.
important thing, key, is that most of all these things you get from vitamins, you can get it from eating right. So if
So,
you eat healthy,
so
then
some people say that they are already old, they are 65, they are 70. They don't need to see a doctor.
65 is not old. 65 is young. So when you classify old, 65 is a very young old. So it's the way you age. Some 70-year-old, you see that they can do what even a 40-year-old is. And I think that the older you get, even from your middle age and younger, you should have regular checkup so that you're able to pick up conditions early. When you pick up conditions early, then you're able to manage it, and this will prevent complications at the time that you're far gone.
Oh, okay. Thank you very much,
Thank
Dr.
you.
Ajala. I think we can stop it here because this is just an advisory and advocacy for our elderly ones to still continue to take care of themselves. Also, it's also important that people should also, that their relations, their caregivers, their children, to continue to assist
Yeah.
them so that because they also need company, they also need to socialize,
Oh yes,
to be able
yes, very
to carry on
important.
the daily
Activities.
activities in
Yeah.
life and so on. So thank you. I think
Thank you very much,
the
Prof.
elderly was heard about this, and we hope that we ensure that they continue to do the very basic that
Yeah. And to
will
know,
be.
aging is not a disease. You age the way you decide to. You. Thank you for having
Thank
me.
you, thank you. Viewers, this another episode of Optimum Health for All. Thank you very much for tuning in and watching our program. Please subscribe. Don't touch that subscribe button. Subscription is absolutely free. Please subscribe. We'll be able to send you other episodes. This one, others, as will probably be the first to know when we have a new episode. Thank you. Bye for now.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the mission, got the vision on deck. Cut the stress, no mess, keep the wellness in check. When we thrive, we shine with every routine. Optimum health, you know what I mean. Optimum health for